Leukemia, a word that often sparks fear and confusion. But what is it exactly? In this video, we'll break down the science behind leukemia, its symptoms, treatments, and what advancements are being made to fight this disease. Let's get started. Leukemia is a type of blood cancer that originates in the bone marrow, the soft, spongy tissue inside your bones where blood cells are made. The primary issue in leukemia is the overproduction of abnormal white blood cells. These abnormal cells don't function properly. Instead, they multiply rapidly, crowding out healthy cells needed to fight infection, carry oxygen, and stop bleeding. Leukemia isn't a single disease. It's divided into four main types based on how quickly it develops and which cells it affects. 1. Acute lymphoblastic leukemia, ALL, common in children and progresses quickly. 2. Acute myeloid leukemia, AML, affects both children and adults and requires urgent treatment. 3. Chronic lymphocytic leukemia, CLL, slow-growing and often found in older adults. 4. Chronic myeloid leukemia, CML, can progress slowly at first but may speed up over time. Acute forms develop quickly and require immediate treatment, while chronic forms can sometimes go unnoticed for years before symptoms appear. The exact cause of leukemia isn't fully understood, but researchers have identified several risk factors that may increase the likelihood of developing the disease. Genetic mutations, changes in DNA can trigger cancerous cell growth. Exposure to radiation or chemicals, high levels of radiation and chemicals like benzene are linked to leukemia. Smoking increases the risk, especially for acute myeloid leukemia, or AML. Previous cancer treatment, chemotherapy and radiation therapy may increase future risk. Genetic disorders. Conditions like Down syndrome are associated with higher leukemia rates. Family history. A small percentage of cases are hereditary. While these factors can increase risk, leukemia often occurs in people with no identifiable cause. Early symptoms of leukemia can be subtle, making it difficult to detect, but knowing the signs can lead to earlier diagnosis and better treatment outcomes. Persistent fatigue or weakness, fever or night sweats, frequent infections, easy bruising or bleeding, pale skin, shortness of breath, swollen lymph nodes, liver or spleen, bone or joint pain. If you notice these symptoms, it's important to see a doctor right away. Early diagnosis can make all the difference. And determine the best course of treatment. Thanks to advancements in medicine, leukemia treatments are more effective than ever before. Let's look at the main options available. Chemotherapy, the most common treatment which uses drugs to kill cancer cells. Radiation therapy, targets specific areas to destroy cancer cells or shrink tumors. Bone marrow transplant, stem cell transplant, replaces damaged bone marrow with healthy cells from a donor. Targeted therapy, uses drugs to specifically attack cancer cells without harming normal cells. Immunotherapy, boosts the body's immune system to fight cancer. Treatment plans vary based on the type of leukemia, its stage, and the patient's overall health. In many cases, a combination of therapies is used to achieve remission. Leukemia research is moving forward at an impressive pace. Scientists are developing personalized treatments, including CAR T-cell therapy, which reprograms the immune system to attack cancer. Clinical trials continue to test new drugs, offering hope to patients who don't respond to traditional treatments. Advances in genetic testing also allow doctors to create therapies tailored to individual patients. The goal is not just treatment but finding a cure, and researchers are getting closer every day. While leukemia can't always be prevented, reducing risk factors can make a difference. Avoid smoking and exposure to harmful chemicals, maintain a healthy diet and exercise regularly. Stay protected from excessive radiation exposure. Schedule regular health checkups. Early detection through routine blood tests can lead to faster treatment and better outcomes. Leukemia may be complex, but knowledge is power. By staying informed, supporting research, and helping those affected, we can make a difference. If you found this video helpful, give it a thumbs up, subscribe to our channel and hit the bell icon for more health-related content. Share this video to spread awareness and let's keep fighting for a future without leukemia.